Hi everyone, welcome back. My name is Hina Mazarudin and I am your Vice President for PAs in Virtual Medicine and Telemedicine. Today I'd like to continue a series of where we highlight some of our amazing PA members and how they work in their respective fields and utilize telemedicine. My intention is that this serve as an opportunity for us to connect and network together and also to highlight our amazing members. You know, I believe that we are stronger together. So without further ado, let's get started. Hi everyone, welcome back. Thanks so much for joining us. Today I have another amazing PA I'd like to introduce you to. Her name is Shannon. Hi Shannon, how are you?
Hey, Hannah, how are you? I'm great.
I'm doing well, thank you for asking. Shannon, can you say how long you've been a PA for and the area of medicine you practice in, please?
Sure. So my name is Shannon Jackson. This year will make 10 years that I've been a PA. Seems like I graduated just yesterday, but yeah, it's been 10 years. I've worked in a variety of roles, including internal medicine, family medicine. I briefly worked in rheumatology. I've also, since the pandemic started, have done a few telemedicine roles, have worked in a couple telemedicine roles. But more currently, I am the newest faculty member with Mercer University's Physician Assistant Program, which I'm completely enjoying.
Wonderful. So we get a chance to work really well with the students, which is a lot of our population is going to be watching this.
Good, good.
All right, Shannon, can you please share with us a little bit more about your experience with telemedicine and what you do with that?
Sure. So I do telemedicine on a chat based platform where patients request to chat with a healthcare provider about anything. And the line is open 24/7. And with the development of the pandemic, some patients would rather seek care from home first before going out in person to a medical facility if they don't have to. So, from the chat based platform, I most commonly address questions like, should I go to the ER or not? Questions about maybe medication side effects or issues related to COVID-19, obviously. And prior to starting the chat, patients are able to upload their info, so their past medical history, their current issues, their medications. They can even upload a picture if they like, just for my review before we start chatting. And then I just begin to address their issues. So from there, I kind of help the patient decide what to do next. And so I usually offer home care options, patient education, over the counter medication recommendations. But due to the limitations of chat based care, the patient may need a more extensive workup or in person evaluation. So at that time, I may recommend that they follow up with their primary care provider or a specialist, or whatever would be the next best step for them based off their complaints. And just due to the technologically advanced nature of the way that we're chatting and the way that we're communicating, I can forward the information that I've obtained from our chat to their PCP or specialist, and they can utilize that to either follow up with the patient either from a synchronous fashion. They can decide to have the patient to come in and evaluate them in person, or they can use that information that I send them to treat the patient from an asynchronous type of standpoint. They can use that info to maybe order tests, order imaging, or just send in a prescription or whatever they feel is best. So that's kind of how I work with telemedicine currently.
That's amazing. And so you also get a chance to work synchronously, like you said, doing a chat back and forth, but then also asynchronously, whether it's through emails or uploading data or even sending, like you said, that data to the PCP so they can do it asynchronously if need be.
Absolutely.
That's wonderful. Can you share with us a little bit about, as far as telemedicine, what you like and what you find to be a challenge, please?
Sure. So I think that I like that telemedicine gives patients options. So it improves their access to care. Like, let's say a patient is immobile or they lack transportation or they're immunocompromised and they want to limit their exposure to COVID-19 by not going out unnecessarily. I like the fact that that telemedicine just opens up those options for patients. I think it's so convenient and so awesome. And I'm so glad that medicine is kind of taking this turn.
Absolutely. And anything you find to be a challenge?
Well, like with anything, there's potential hiccups that can occur with the technology. So if there's like a internet service issue or buffering or a lag, or if you lose a patient due to the internet service, sometimes it can be challenging to get the patient back. But that will be maybe the biggest drawback I'd say. But overall, I think telemedicine is great.
Wonderful. Can you share with us a message or a clinical pearl of wisdom for our PAs and PA students? What would that be, please?
Sure, I would say treat your last patient of the day like you would treat your first patient of the day. Our days are long as providers, and undoubtedly you'll get tired, you'll get worn out, but you never know what it took for that patient to get in to see you that day, or to get to talk to you, or to even chat with you virtually that day. It may have taken a lot of courage for them to seek you out. So your demeanor can make or break that experience for a patient, and can even affect the outcome of their health. So everybody deserves kindness and respect. So I'd say just treat the last person like the first person of the day. That'd be my advice.
That's wonderful. Thank you so much, Shannon, for sharing those wisdom and pearls with us. And thank you, everyone, for watching. We'll see you next time. Take care, everyone. Bye.